I did my presentation about a disease called Brugada syndrome. What is Brugada syndrome? Brugada syndrome is a heart disease that causes the heart rate to beat in an abnormal rhythm. The rate becomes dangerously irregular during times like sleeping or resting. This disease is mostly inherited, as 60% of patients have a family history of sudden cardiac death. So here we can see that how it works. If there is an affected parent marrying and having a kid with an unaffected parent, then there is a 50% chance of having a child with Brugada, and there is a 50% chance of having a child without Brugada. Clinical characteristics. Most symptoms will start being present in adults through a large majority of people get diagnosed from infancy up to late adulthood. The mean number of the death of Brugada patients is 40 years of age. It is mostly present in people who are from Southeast Asia. How common is Brugada? Brugada is quite difficult to identify due to recent discovery. It was first discussed by researchers in 1992. It is estimated that Brugada causes 4 to 12% of unexpected sudden deaths worldwide. So we can see researchers made a research about Asians to white people, and we can see that it's mostly males getting affected by Brugada. Signs and symptoms: dizziness, fainting, gasping, having difficulty to breathe, especially at night, irregular heartbeats, extremely fast heartbeat, and seizures. Treatment. Doctors may use ICD. This is a small device placed in your chest that helps monitor your heartbeats and sends an electric shock when there is an abnormality in your heart rate. Some negative effects is that the device may sometimes give electric shock even when it's not needed or necessary. Quinidine may also be used. This is a drug that helps control the heart rate. Lastly, we have a procedure called catheter ablation. If ICD fails to work for a patient, doctors will recommend this procedure. In catheter ablation, doctors insert a long tube through your blood vessels to your heart. Then it delivers energy so the heart tissue or area responsible for the irregular heart rhythm is destroyed. So also we have 3 types of Brugada. Now we have type 1. This is a very prominent type. You can see in the CT segment here is like extremely cold. And in type 2 it's less. This may raise suspicion of having Brugada, but then you should have further testing to be sure. And type 3, this was characterized with a not prominent saddleback shape, and then this may not raise suspicion of Brugada. Some people characterize it as a normal mistake in heartbeats.